Good morning to everyone, to Abdiel, to the sign language interpreter, and the audience who listens to us every day. Today we report 1,024 hospitalized patients, 29 under medical supervision, 478 are suspects, and 517 are confirmed active cases. Yesterday, 4,549 samples were processed at the molecular biology laboratories of our country. However, we should reach 5,000 samples as for today. At the Tropical Medicine Institute Pedro Curie, 1,058 samples. At the Provincial Center of Hygiene, Epidemiology and Microbiology of Villa Clara, 871. At Havanas, 728. And at Santiago de Cuba's, 285. At the Genetic Engineering and Biotechnology Center, 427. At Hermanos Amejidas Hospital, 378. At the Naval Hospital, 186. At Manuel Fajardo's Hospital, 180. At the Genetic National Center, 146. At the Center for Molecular Immunology, 142. At Fructuoso Rodriguez Hospital, 89. And the National Civil Defense Center processed 59 samples. As a result of the analysis of these 4,549 samples, 47 people tested positive for COVID-19. Thus, we accumulate 377,494 processed samples and 3,806 people, that is the 1.01%, have been diagnosed with COVID-19. Every Cuban province managed to process samples depending on its epidemiological complexity. Havana province, with the highest figure, processed 3,181 samples. Matanzas, 219. Villa Clara, 260. Camagüey, 124. Santiago de Cuba, 145. Pinar del Rio processed 98 samples. Artemisa, 68, and so forth in every Cuban territory. The 47 positive cases are Cuban, 40 are confirmed case contacts, that is the 85.1%, which denotes the importance of this risk group. Thus, Cuba accumulates 3,396 people, the 90.7% have been confirmed case contacts. The source of infection of 7 patients is yet to be determined. For a cumulative of 14 people in the last 15 days, the 0.4% source of infection is unknown. 335 patients, the 8.9%, have the source of infection abroad. 24 are male and 23 are female, which maintains a balance that is 50.2% and 49.7% respectively. 38 patients, that is an 80.9%, were asymptomatic at the moment of the test. Thus, 2,199 people, the 57.8% of all confirmed cases in Cuba, did not present any symptoms while being tested. When revised in the last 15 days, the figure is 58%. I always highlight this characteristic of the disease, not a convenient feature, considering the fact that we're unable to identify the person who carries and transmits the disease while presenting an asymptomatic condition. Hence, all protection measures must be strictly complied, especially in the territories with higher rate of transmission, like the provinces of Havana, Artemisa, Villa Clara, Pinar del Rio, and these days Matanzas has also presented a significant risk of transmission. 4 individuals are under the age of 19 or up to 18 years old, for a cumulative of 395 patients, of which 362, the 91.6%, are discharged from hospital due to the favorable evolution. 23 patients belong to the 20 to 39 age group. Note that 27 patients are under the age of 39. More than 50% of all cases are young ages, and we insist in maintaining a disciplined behavior. Many of them are confirmed case contacts, though, but are still considered a significant risk group. 16 patients belong to the 40 to 59 age group, and 4 patients with 60 or more years of age. 19 of the 47 diagnosed cases belong to Havana province, 13 to Matanzas, 5 to Artemisa. The provinces of Ciego de Ávila and Las Tunas report 4 cases each, and Villa Clara and Camagüey 1 case each. In Artemisa province, 2 patients are from San Antonio de los Baños municipality, 1 from Mariel, 1 from Alquizar, and 1 from San Cristobal. We all know about the transmission events in this province, which have clearly affected many municipalities. In Havana province, 7 patients are from Arroyo Naranjo, 2 from Regla, 2 from Habana del Este, 2 from Centro Habana, 2 from Plaza de la Revolución, and Guanabacoa, Boyeros, San Miguel, and La Lisa municipalities report 1 case each. We always remark the evident spread of the virus in Havana province that covers all of its municipalities. In Matanzas province, the 13 diagnosed patients are from Cardenas municipality. In Villa Clara, the patient is from Manicaraguan municipality. In Ciego de Ávila, the 4 detected cases are from Venezuela municipality, and the source of infection of 2 of them is yet to be determined. Camagüey reports 1 case from Florida municipality, whose source of infection is still unknown, and Las Tunas reports 4 cases from that municipality, and all of them linked to the family focus of transmission detected in that city. Thus, Havana's rate per 100,000 inhabitants is the highest in the country, with 23.04, Artemisa's 13.79, Pinar del Río's 5.48, Villa Clara's 1.08, Matanzas 3.47, higher than the previous day, as well as Artemisa's. Las Tunas' incidence rate is 1.31, Mayabeque's 0.52, Ciego de Ávila 0.92, Camagüey's 0.13. This way, Cuba increases its rate to 5.78. With this behavior, of the 3,806 diagnosed patients in Cuba, 517 are confirmed active cases, that is 13.4%, of which 496, that is 96%, present a clinically stable evolution. We did not report any fatalities yesterday, so the figure of 92 deaths remains unchanged, and a mortality rate of 2.41%, in opposition to the regional rate of 3.53% and the global rate of 3.42%. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 36 people were discharged from hospital, still a negative balance between discharged and hospitalized patients. 28 are from Havana province, 4 from Artemisa, and 1 from the provinces of Villa Clara, Ciego de Ávila, Holguín, and Guantánamo. Thus, we accumulate 3,195 recovered patients, which is the 84% of all diagnosed cases in Cuba. 6 patients are in critical conditions, 15 in serious conditions, all of them from Havana province and admitted to Havana's hospitals. 4 patients joined the serious condition, 1 the critical condition, and 2 previously reported as serious are now critical. Before providing a general outlook of the worldwide situation, Lillian will help us present a chart showing Cuba's epidemiological situation. This has been the behavior of the disease on a daily basis, represented by those bars. Right after we attained to control the high figures of contagion in the months of April and May, there's been an increase of infections in the last weeks. Reviewing the last day's pattern, the curve shows a decline. However, today's results do not favor this downward curve. Following, we can also see in Havana province practically the same behavior as the country's curve. We are expecting lower figures of diagnosed cases in this province, as has occurred in the last days, although the spread and the amount of infected people is still significant. Finally, the last chart shows the most unpleasant side of the pandemic, that far from presenting itself as a simple flu, it brings several complications and entails a large number of patients in critical and serious conditions, as well as a significant amount of deaths. The highest number of people in these conditions was detected in April and May. We got to control the situation once the incidence rate also decreased, However, there's been a new increase in the last days, which is what led us to the aforementioned results. Concerning the worldwide statistics, in the last weeks, a group of countries that had already achieved a proper control of the pandemic and had passed to the post-COVID phase have now restored their restriction measures due to the new behavior of the disease. The same 185 countries remain to diagnose COVID-19 cases. 254,637 people were diagnosed yesterday, for a cumulative of 23,928,539 infections. 5,812 people died yesterday, which amounts 819,756 fatalities, for a mortality rate of 3.42%. The region of the Americas, the epicenter of the pandemic in the last weeks, reports the 53.4% of worldwide diagnosed cases. 125,661 new cases were confirmed. 4,075 people died yesterday. Thus, the region accumulates 451,613 fatalities and a mortality rate of 3.53%. The United States, with 5,759,000 confirmed cases, Brazil, with 3,669,995, and India, with 3,234,474 infections, top the list of the most affected countries by the pandemic. Of the more than 4,000 deaths in the Americas region, the United States reports 1,207, Brazil reports 1,271, and then India reports 1,059 deaths. Mexico also reported 650 fatalities only yesterday. This is all the information on the situation of Cuba and the rest of the world.